Hey everybody, welcome to the Measles 101 Live. We will give just a minute for people to come and join us, and then we'll go ahead and get started. So welcome. Hey everybody, I see some folks are joining for the Measles 101 Live, so we'll give just a moment for people to continue to hop on, and then we'll go ahead and get started. I'm Kirsten Short. I'm the Chief of Epidemiology here at the Houston Health Department, and this is our Tuesday Measles 101 Live. All right, let's go ahead and get started. One of the things I was going to start with today was to do kind of an update on where the numbers are with this outbreak and why we keep talking about measles so much. So the national numbers are updated every Friday. And so on Friday last week, the numbers were updated. And so there have been 712 measles cases in the United States in 2025. And of those, what does it say? 93% of those are associated with outbreaks. So we've got obviously the West Texas outbreak that we'll talk about, but there have been several other outbreaks in the United States here in 2025, many of them related to the West Texas outbreak. But with 93% of those being related to the outbreak, that means that there are about 52 cases of measles in the US this year that are not related to outbreaks. So those 52 cases generally represent their own kind of introduction of the measles virus into the US, generally from people who are returning from international travel to an area where measles was circulating. And usually they are, not always, but usually they are in travelers who were not vaccinated for a variety of reasons. And so I say that just to kind of reinforce that we do continue to have introductions of measles into the US. And so even though the West Texas outbreak is really sort of happening, we might say over there, right, in West Texas, we need to continue to sort of be vigilant, to think about how we can protect ourselves, how we can protect our community, and what we can do. And we do know, right, that the best way to protect ourselves, to protect our community, to make it worth it is really through the MMR vaccine. So let me talk a little bit more about Texas. So the numbers in West Texas, the state does it a little differently. They update their numbers on Tuesdays and they update them on Fridays. So they updated their numbers today. So these are hot off the press. So they are up to 561 cases of measles in Texas, specifically associated with the West Texas outbreak. Of those, we've got 58 people who have been hospitalized in Texas for measles. And unfortunately, we do have the 2 deaths that have been reported in Texas in school-age children who weren't vaccinated. And so the vast majority of those cases are really happening in the counties that are around Gaines County, which is where the outbreak was first detected. But we have started to see some cases detected in other parts. So a little while ago, we saw some cases detected in Lamar County, which is up in sort of the northeast section of Texas, one of those counties. And more recently, we've seen 7 cases that are associated with the outbreak over in El Paso, so all the way out there on the other side of West Texas. So talking a little more outside of the outbreak, we've also had 7 cases in Texas in 2025 that have been reported this year that are not associated with the outbreak. So those are different introductions of measles into here. We've had our 3 cases in Houston that we've talked about, 2 in January, 1 in March. We have 1 case in Harris County, sort of the area outside of the city of Houston, 1 in Fort Bend County, and then 1 in Travis County over in Austin, 1 in Rockwell County, which is up in sort of the DFW area. So those represent generally different introductions of the virus into Texas from different events. We have our 2 cases in January that were linked to each other, and so far we've been really fortunate that we have not seen any additional cases associated with any of those. We are still in what we would call the incubation period, the chance when we might see additional cases for the most recent of those cases, which is the one in Harris County. So those of us in public health are monitoring people who may have been exposed and keeping really a really close eye out to see if there will be any additional cases and what we can do to keep that from spreading further. Things that we can do to keep things from spreading further, right? So I kind of see how I rolled that right in. Right, so some of the things that we can do to keep spreading further, like I talk about, the best way to protect yourself is to be vaccinated. So really, we start vaccinating children at 12 months of age. But if you have a child that's younger than that, right, the vaccine is safe to give to children as young as 6 months of age. We don't usually recommend it on a routine basis that early because a lot of times that child is going to have antibodies from their mom that's still circulating, giving them some level of protection. But in cases where you might be traveling to an area where you might see some circulation, it is certainly safe to give to babies as young as 6 months of age. And so you can definitely talk with your pediatrician about that if that's something that you've got travel coming up, or maybe even just be thinking about traveling on that side. Other things that we do in public health, right? We've talked about this a little before, but let me go over it again, right? Is we look for people, when we get a case of measles, we talk to the person with measles or their adult, if they're a child, right? To find out where they've been during what we call their infectious period, which is, remember, that's 4 days before that measles rash starts. You've got your day of measles rash and 4 days after. So in kind of that 9-day window. Where were people when they might have been exposing other people to the virus? And then we do our best to reach out to people who might have been exposed to let them know. When we reach out to those people, what we call contacts, right? Exposed contacts, we're talking about, do they have protection, right? Are they already vaccinated? And then we can talk with them about what they might need to do. If they don't have protection, then they're not vaccinated. Then we talk with them about what they might need to do. When you don't have protection, when you don't have that vaccine, what we really need you to do then, because you've been exposed, is to stay home and stay away from other folks. Because remember, you start to be infectious before that rash shows up. And so even if you might have the best of intentions that you don't want to make anybody sick, you don't know because you haven't seen that rash show up yet. I see a question in the chat over here. Is there a website or some way I can find out what areas have been affected by measles? So there's a couple different things that we have here. So if you go onto the state website, when I say they post their Tuesday updates and their Friday updates, they actually have a map on their measles outbreak website that says what counties have measles cases. And then if you scroll down below that, near the bottom, they'll have where our non-outbreak cases have been reported. In Houston, when we've got cases that have come up, we've also shared that information. And then finally, there's information for travelers on the CDC's website. Right now, there's really just a global travel advisory. There's measles circulating in a number of different countries. And so it's really recommended to very strongly consider getting vaccinated if you have any international travel coming up. So we are getting to the end. So if you've got any more questions, go ahead and pop those in the chat and we will take a look at those. Are the antibodies only from a vaccinated mom? If mom isn't vaccinated, is the baby safe? That goes back to what I said earlier, and that's a great question. So when we talk about, we don't usually give the vaccine right below 12 months of age because babies may still have immunity or that antibody circulating from mom. She's absolutely correct. Those are only if mom was vaccinated. And so if mom doesn't have immunity, then baby doesn't have immunity and baby's not going to have that protection either coming through. So that was a really great question, something good to keep in mind as we go through. I will tell you, when I think about vaccination, I think about it for my community, right? This is something that I can do for me, for my kids, for my community, the people I work with, my community, the people I live with, my community, people my kids go to school with. And so I hope that you can think about your communities as well. And we will be done for today, and somebody will be with you on Thursday. Bye bye, everybody.